Hi, I'm Roy Bichtel. I'm a physical therapist and I work with the folks here at Physical Therapy First. I have my own practice at Yes Physical Therapy. I'm here with the Physical Therapy First tip of the week. We're going to be discussing back pain, something that almost everybody has had or will have. And in spite of what you may think or feel, research tells us that the best way to cope with back pain is to stay as active as you can. There are many causes of back pain, of course, and we're just going to be talking about one today, and that is sacroiliac joint movement dysfunction, or SIJ dysfunction. Most of the time, what causes an SIJ dysfunction is a sudden high-effort muscle activity, something that you might find in a trip or a fall. You might have caught yourself and stopped yourself from falling, and you might have forgotten all about it, but your SIJs might be remembering it for you. Today, many people are suffering needlessly with back pain because sacroiliac joint movement dysfunction is so hard to diagnose. This is partly because sacroiliac joints are hardly ever the cause of the problem. Usually, because of the many muscular connections that can affect the sacroiliac joints, the problem is actually somewhere else, and it results in the sacroiliac joints not being able to move nicely. Your friendly neighborhood physical therapist is an expert in treating and diagnosing movement dysfunction, so we can easily diagnose and treat SIJ dysfunction. First, we'll start you out in standing, and after you take a few steps in place, we're going to see if your feet point in the same direction. And you can see here that they pretty much do. That's fine. And after that, we're going to look at your feet. If they're not pointing in the same direction, we have clue number one, as you see here. Next, we'll take a look and see if your hips are at the same height. And if they're not at the same height, as you see here, we have clue number two. Next, we'll have you lie down and take a rest. Here, we'll be checking the leg lengths. Straighten. Good. And if your legs are not the same length, as you see here, the left leg's a bit shorter, that's clue number three. Now, if it's not going to cause any pain, we're going to check hip flexion, because hip flexion requires movement not only at the hip, but also at the SI joint and the lumbar spine. So we're just going to see if it's the same movement on both sides. It stops right about here, about 90 degrees of hip flexion. Next, we'll check the other side. Again, if they're not the same, we have clue number four, and you can see that this one goes much further. All right, now we're going to flip you over and take a look at those 3D puzzle pieces that we talked about before, the sacrum and the two ilia, with the ITs at the very bottom. So here we go, sacrum. This sacrum is twisted to the left, so that's clue number five. The ITs are not level, the right one is higher, that's clue number six. Now if we find this particular pattern, we have an easy fix, and it's probably a good place to start our treatment. On the side that's higher, we're going to ask our patient to bend his knee. Now all we have to do is get him to lift this leg a little bit off the table and hold it there for about 6 seconds. Great, and after we've done that, you can relax. We're going to move him out to the side just a little bit, all right? And do that same thing again, lift and hold. Very nice. Feeling okay there? Excellent. Every time we do this, it should get a little easier. Relax. A little bit further, and one more for the road. That's it, just lift and hold, about 6 seconds. Very nice, and after we've done 3 of these, we can come back and retest. And we should find that those puzzle pieces have rearranged themselves into something that looks a lot more normal. So the sacrum is now level, the ITs are now level, and his SI joint should be moving much better. Have we fixed all the problems? Probably not. However, we have normalized muscle tone around the sacroiliac joints, and the patient should be feeling better at this point. It gives us the opportunity to go on and do further diagnosis in terms of finding the real source of the problem and what it was that caused the SIJ movement dysfunction to begin with. Your friendly neighborhood physical therapist will go ahead and do a very thorough physical exam. We'll probably take a look at your ankles, your feet, your hips, your knees, your low back, your thoracic spine, because all of those areas can also contribute to low back pain. And after we've done that, we're going to make a plan that will keep your back feeling good for a really long time. As Consumer Report says, and the CDC, if you have pain, you should try physical therapy first. You'll be glad you did. If you have any questions or would like to make an appointment, give us a call. The number is 1-855 PT First. You can also find us on the web, physicaltherapyfirst.com. And you can find me on the web at my website, Yes Physical Therapy. Thanks for watching this Physical Therapy First tip.